Hello and welcome. I'm Uday Pratap Singh. You're joining us on this special show on NewsX as part of our special Sehat Week coverage. Yes, we're joined by a power-packed panel of medical experts from across the country to decode the burning issues concerning, of course, the health scenario in the country, COVID vaccine, when will it come, what will be the rollout? Also, what are some of the fears which need to be allayed of our countrymen as we await the vaccine? Till then, how do we build our immunity? How do we keep our health strong? Those will be, of course, some of the focus areas for this show. We have, as I told you earlier, a power-packed panel with us. Dr. S.K. Sareen, Director, ILBS, is joining us live. Dr. Ashok Seth, Chairman, Fortis Escorts, Heart Institute, is live with us. We also have Dr. M.C. Mishra, former Director, AIMS and VC, MG University, joining us live. Dr. Romal Tikku, Head Internal Medicine for MAX, is also with us live on the broadcast. Thank you all for being with us today on NewsX. Let me begin with you first, Dr. Sareen. As the country awaits the vaccine, and as we, of course, see that the UK has begun its rollout, the progress, sir, so far, quite satisfactory in your opinion? We saw the Prime Minister, of course, visit the various vaccine hubs. We've interestingly seen various envoys of multiple countries also make a beeline for Hyderabad. So far, progress for the vaccine satisfactory in your opinion?
Well, I think world today is like a village where all the country people live together. Whatever happens in India is reflected immediately overseas, and what happens in the other countries is smelled, sensed, analyzed by everyone across the world. So the developments all over the world have been rather exceptionally fast. And UK had taken the courage with great wisdom of approving this Pfizer-BioNTech vaccine, which is an mRNA-based vaccine. So I think it's a remarkable progress for us. The reports as of now seem it is a very good vaccine, but I want to tell you a little bit about the Pfizer vaccine in the beginning. The other vaccines use an adenovirus where you have a virus which is not active, and you put some protein or a gene of the COVID virus. So now this virus goes into your body. It is taken by your body's immune system to make antibodies. The Pfizer vaccine uses some lipid nanoparticles, fat in a very, very micro thing, which carries a small portion of the COVID virus. Now it goes in, your body's immune system, the T cells pick it up, the lipid dissolves into the cell, and now the virus, small part, not the full virus, part comes and your body starts making proteins. This is a new experimental way of doing the Pfizer vaccine, but very effective. The advantage is it doesn't use any other virus. So the fear is a little less with the mRNA vaccine. But there could be new fears, and there can be, therefore, many challenges with the mRNA vaccines as well. And that's what you have seen, allergies, rashes, and others. So in my opinion, the development of vaccine and the COVID has done immense benefit to the science of vaccinology, development of this. And we therefore feel it has been immense progress. But of course, for all vaccines, like I work on hepatitis B. When the hepatitis B vaccines came earlier, they were taking out from the plasma of the infected people, the antigen, the protein, the same way as we are in 1970s, we were there. But when the vaccine came, initial vaccines gave some brain, some inflammation, and people were very worried. They didn't want it. Italians raised hue and cry. But now a safe vaccine. So we are in the very first phase. I think the progress, as you asked, is super satisfactory. Yes.
But interestingly, Dr. Sareen, 2 requests so far have not been acceded to for emergency use. More data has been asked for from these companies. What can be read into that?
Well, I think it's the pure wisdom and scientific acumen of the Indian people in the committee, the advisory committee. They have taken must have taken a very wise and cautious decision. Firstly, India doesn't have emergency authorization procedures, but yes, if it is in public interest, anything can be suggested and approved. But since the data, especially for the 2 vaccines, the Bharat Biotech We don't even have adequate phase 3 data. And for the Oxford and AstraZeneca, which is a global trial, India is not having an independent trial and therefore a global data, especially AstraZeneca being the European company. We need a data from that company where they published 2 days ago. I have read the detailed part of that Lancet paper. It's very interesting, looks effective, but yes, it is in a small 1,000 group of just volunteers. We need large data, and the data which submitted was still, let's say, mid-November. We need data updated, and side effects only come maybe after second dose and then another month or two.
Okay.
So we need to be careful, and I admire the Indian Drug Controller General and the other committee members for standing up and not just bending on the frame of a rat race and approving the vaccine with a clear shot.
Okay. Dr. Seth, we need to be careful, says Dr. Serene, but, I think one question, of course, is there in everyone's mind across the country at this point, which vaccine is going to be best for Indians, What's the answer to that question, Dr. Seth, in your opinion?
A very interesting question. And of course, we must remember that there's not going to be one vaccine which is best for India. That's taken for good because we have a 1.2 billion population. We will require a number of vaccines, and that is the reason why the government in its wisdom has actually promoted research into a number of vaccines, which are going through various phases of studies. And as you know, 2 of them are already in phase 3. In fact, that's the reason why even the Russian vaccine is being researched into India with the possibility of and it's having phase 3s in India with the possibility of having multiple vaccines. But the important crux of the matter is that it's not just a variety of vaccines, but it's also got to be cost-effective vaccine. It has to be safe vaccine, and it has to meet the logistics of vaccinating vast number of people. Therefore, the cold chain, the logistics of the vaccine itself have to be particularly suited to a country like India. For example, we've just heard about the Pfizer vaccine. One of the deficiencies of it, let alone the cost of the Moderna and the Pfizer, they're priced at anything between $30 and $40. But when we actually look at the logistics of Pfizer, it is a cold chain of minus 70 degrees centigrade, which minus 70 degrees, which does not exist in India at the moment, in which large amount of investments would have to be made to create a cold chain of minus 70 degrees right to the end user from its acquisition to the end user. Same goes for Moderna, which is a minus 20 degrees cold chain.
Yes.
But when you start getting to more user-friendly vaccines, they're usually the ones which are refrigerated in the fridge. That is what AstraZeneca is. That's what we're looking at, the other vaccines which are being actually researched in India. And 3 of them are from India and 2 of them are from abroad. AstraZeneca and Sputnik are the ones from abroad which are going through the phase 3 studies in this country.
Okay.
Now that makes so the 2 aspects become that they've got to be effective, and virologists feel that anything more than 50% effectiveness is a good vaccine. Right. Here, certainly a lot of hype has occurred around 90 and 95. It looked like a number to be beaten, but that's not necessarily the case.
Okay.
A vaccine could be 70% effective, but if given uniformly to a vast population of patients, could create adequate herd immunity so that the virus does not survive.
Well, this statement of yours is helpful for our viewers. But what else needs to be said, by government as well, in terms of possibly a communication campaign to allay the concerns of citizens before taking this vaccine, sir? Do you believe people in public life, dignitaries should sign up to take the vaccine, celebrities should be involved? What needs to be done to allay the fears of the public so that they do take the vaccine eventually?
Oh, it is so important. I must say that at this time, a lot has been looked at. There's been, while you may say that 5 years research has been done in 1 year's time, but there's also another aspect that it's happened because the whole world got together to a single focus, and there was sharing of knowledge. In fact, even the messenger RNA vaccine, the science actually arose from Europe. It is just Pfizer took that science and actually manufactured the vaccine faster. So there's been distribution of knowledge. There's been actually sharing of research, and there's been accumulation of, while more data is going to come, there's been adequate accumulation of data to actually make us understand that whatever is going to come out is going to be of safety. And you saw that. The Indian regulatory authorities themselves are going to take their time for approval so that Indians can have a safe vaccine. However, concerns and unfortunately, propagandas are also arising out of this. Yes, there is a group of people across the world who actually don't believe in vaccines, whether it's now or whether it's in the past or any vaccine. They create the propagandas. Then there is a politics behind all this, and we've actually seen that happen. But the real fears are there, definitely. But what is going to allay the fears is that, firstly, we have the advantage that the vaccines which are going to be available in India are already started its vaccination out in the West. So AstraZeneca has already started vaccinating, is going to start vaccinating by the end of this year because its approval is expected by the end of this month, and it's going to start having. Sputnik has already started, the Russian vaccine's already started its vaccinations in Russia and many other countries. Now we're going to have adequate data, even more on safety, when India starts its vaccination program.
So that will be further reassuring.
So that will be further reassuring.
Dr. Mishra?
Thirdly, and I'll just say, thirdly, it falls upon us to make people understand, and you're right, we are the ones who are going to come up. And by the way, as you very well know, the healthcare workers are the first ones who are going to get vaccinated. And we ourselves will be the role models for telling everyone that this is the way to go, this is the path to follow, and this is the only way to actually be the one.
Leading from the front once again.
That's right.
Dr. Mishra, what will also be, of course, important is the development and creation of infrastructure, cold storage facilities and other logistical, developments for transport, distribution of the vaccine. We're already hearing of a Luxembourg firm which is looking at investing in Gujarat to set up a cold storage facility for one of the vaccine candidates. Do you believe all of that needs to be worked on as well, even as we look at the data and our committee safely will give the emergency use permission when it will be fully satisfied, as you've been saying on multiple occasions as well?
Let me little bit give background of what we are talking about, the RNA, the protein, the viral vector. So I'll give you a sense what's the global scenario right now. About 240 vaccine candidates are in development. Protein subunit, that is the COVID spike protein, is being used by 76 of them, and 14 are in clinical trial. Viral vector, what Dr. Sareen was mentioning, adenovirus, are 52 in making, 8 are in clinical trials. DNA and RNA, 50 are in making, 11 are in clinical trial. Inactivated vaccines, what we say inactivated virus, which was the usual norm in the previous vaccine developments, 14 are in development, 6 in clinical trial. Virus-like particles, 13 and 1. And then live attenuated, which again was very common in yesteryears, and 4 vaccines only. So you can imagine that technology has been given away for newer technology. And why this has taken less time for development, significantly less time. If you look at the timeline for vaccine development, it used to be 10 to 15 years. Preclinical animal trial, phase 1, 2 years, phase 2, 2 to 3 years, phase 3, 5 to 10 years. Because there are still, you are also asking a lot of questions, but there are no answers to those. So those are the answers which were made available by taking this much time. And then after phase 3 is completed, it goes for approval to the regulators, as we are watching. It is the interim results have been submitted to DCGI, US FDA or UK regulatory authority. So is interim. That's why the committee has to be really convinced that this data is genuine, and they may ask for a raw data of the trial. That is very, very important to look at that, so that we do not cut sorry figure after giving approval, and then only it goes for production and mass consumption. And then there is a post-marketing survey, that is phase 4, which goes on. So that used to take 10 to 15 years. So as regards the cold chain maintenance, See, India has something we call, and mind you, 6% of these vaccine will only see to the market.
Yes.
Out of 240. So that you have to understand. And then as regards the cold chain, we have experience of mass vaccinations right from smallpox in 1973. Dr. Sareen would remember. We were undergraduate students at that time. Dr. Seth also would remember. And we participated as medical students in mass vaccination programs for smallpox eradication. And 75 smallpox were eradicated from India. We have seen the polio vaccination abhiyan all along, and polio has been eradicated. So we have the infrastructure. Naturally, when we are saying mass vaccination, the population has grown over a period of time, and we are not looking at that we'll find each and every person in the nook and corner of the country of 130 billion people. What we are aiming at 60%, 70% population covered will give what desired results, that is breaking the chain of infection and transmission. I think that is what we are looking at. So we have the cold chain for 2 to 8 degrees, which can be easily upgraded, which can be easily strengthened all across India. Because we have this Indradhanush under Ministry of Health for children vaccination.
That's very integral. Vaccination. And that will kick in. Yeah, that will kick in eventually. Okay, before I go back to Dr. Sareen, Dr. Tiku, come in here on the government's plan so far for the rollout, the timelines. In your opinion, how do you view them? And also in terms of, just how this year has panned out, do you believe we have ramped up our health infrastructure in time? Various targets have been met, or has there been scope for improvement?
Well, I would say India has done tremendously well. You look at the global scenario, look at US, they're having more than 2 lakh cases a day even now. And look at what happened to Europe when it all started. Now they're seeing some sort of a respite. But in US, Brazil, you're still having numbers. But if you look at India, India has done pretty well. And there's a declining trend for sure. If you look at the last 2 weeks, numbers have definitely gone down to now less than 30,000 a day. And a couple of months back, it was about 1 lakh cases a day. And look at our economic resources. Look at our healthcare infrastructure. I mean, we can't compare ourselves with the European Union, the US, UK, but we've done pretty well. And whether it was the decision about the lockdown, our government was very decisive, quick. It all worked for us. We were pretty lucky, but at the same time, the government was very proactive. And whether it was the ramping up of the infrastructure, increasing the ICU beds, manufacturing the kits, involving more and more labs, we've all done it. Imagine a country like India, and we are still at number 2, and we've done pretty well. Look at the mortality rate, excellent. So India has done pretty well. And now we are getting into that phase of research and development regarding the vaccine. Our own Prime Minister has been pretty active. The government has been so active regarding the vaccine. So we have at least 4 to 5 front runners as far as the vaccine goes. The trials, phase 2, 3 trials are going on. In fact, the top one, I would say India's best bet would be the AstraZeneca vaccine, because the trials are going on here, and millions of doses have already been manufactured by Serum Institute. Now, Serum Institute is the largest vaccine manufacturer in the world. They also have a tie-up with Novavax, which is a US company. And then our indigenous vaccine, the Covaxin, which is an inactivated virus. And cost is a major factor. Apart from safety, efficacy, immunogenicity, it's the cost. Then it's the storage, the cold chain, the distribution, dispersal. India has struggled with distribution and dispersal in the past, especially with adult vaccination in pregnant women. But with children, we have an excellent record. We have our great record as far as immunization policies and programs are concerned in India. And that experience will sail us through. And now we are at a stage where soon we might have actually, as Dr. Seth said, 2 to 3 vaccines candidates which are ready for emergency use authorization. And that will be great. If you have a weapon like a vaccine to break the bone of this virus, it can be used as a weapon of mass destruction.
You're quite hopeful.
I'm very hopeful. India is doing very well, much beyond the expectations.
Yes, but interestingly, of course, you are you're pinning your hopes on Covaxin and of course AstraZeneca as well. But Dr. Sareen, quickly coming back to you, of course, these are the timelines for the vaccine. But till then, experts have been talking about the importance of building our immunity. In your opinion, Dr. Sareen, how important is it to build our immunity, and some advice also you'd like to give to our viewers watching on how to do so?
One point before we go, because that might be important.
Yes.
The difference between efficacy of a vaccine and effectiveness of a vaccine.
Yeah.
Vaccine can benefit in 4 ways. One, if you get a vaccine shot, you may be protected totally.
Mhm.
Second, you get a vaccine shot. If the infection comes, you may have a milder infection. So you're partially protected.
Mhm.
Third, if you are having a vaccine shot, you may not transmit the virus. Fourth, and very importantly, if you get a vaccine, if you get a virus, you will not go to ICU or you will not die.
Yeah.
So effectiveness of a vaccine versus efficacy. Today, all trials are assessing efficacy. How much antibody, what level, what percentage of people are making antibody. That's simple efficacy. Effectiveness of the vaccines will come maybe in a year or 2. So whatever we are talking are still in nursery phases. And it is important for us to know that 2 doses are required. But the data from AstraZeneca is amazingly good. First shot, 1 single shot, the Lancet paper says, on day 14 to day 28, 90% of the people had efficacy. When you got the second shot, many more got the efficacy. Therefore, what we are looking for tomorrow, and maybe even these vaccines, 1 time and done. You don't need a second dose. So that is the way we have to move forward. I hope we will have 1-shot vaccine so that we have. And also, if you start doing vaccination even in mass, let's say you start doing 55 million people to 50 million, not 50 million, let's say, but 500 million of people every day, you will require nearly 4 to 6 months to cover the country. And that is where herd immunity will come.
Okay.
So unless you have vaccinated a very large proportion of patients, you will not have. Herd immunity means that 70% of the people either have been exposed or have antibody levels.
No, that's a good point you made on the efficacy.
If you don't have antibodies, protective antibodies. Now in India, let's say Delhi, the survey said 25% have antibodies, but these antibodies are not neutralizing antibodies.
Mm-hmm.
So we need to be sure, and the people ask, look, I have got antibody, why should I get a vaccine? But look, guy, your antibodies were a IgG, may not be neutralizing. Therefore, to have a second shot is not a problem.
Very important, because a lot of people feel that, oh, we have antibodies, now we're safe,
Now we're safe. So the antibodies are of 2 types. One is simple IgG antibodies, which is a reaction. But of that, the antibody which is neutralizing is the antibody against a spike protein. That's what your vaccine makes.
Okay.
So vaccine makes antibody against a spike protein. That spike goes to enter the cell. So that antibody you're safe, not otherwise. So we
coming back to immunity, sir. On the power of immunity in building our strength, and also what should be done to build our immunity.
Well, I am a strong proponent of having a good hygiene, a good health, and a regular exercise. I'm not sure any amount of food, although Ayush and Ayurveda, the people say a lot about this. I'm not sure, because what you need is an immunity around your neck and your throat area. The nasal vaccines are very good. So I'm not sure the immunity is improved. And I cannot recommend I don't have scientific knowledge that use plants or herbs. Yes, vitamin C, vitamin D, immune modulators, zinc, these are magnesium. These are, at least in our science, they are known to immunity increase your immunity. I would recommend everyone to use them, have good healthy food, and the biggest immunity is by your mask. Don't take it out. Since I'm sitting alone, don't take out from nose or your face. And one small point is we need to develop a system where people can report side effects. One is passive reporting, one is active reporting. We need a telephone, a mobile network. Let's say 80,000, 5 million people get a vaccine. How will you get the side effects? We must have a system in place before massive vaccination. Everyone can say on mobile, buy a message, look, I have a side effect, I don't have. A very large survey was done in European countries. When such a mobile system was used, almost 12% started saying, I have a side effect. But if you don't have it, people don't know how to report it.
Yeah.
So to have correct picture of initial, let's say 5 million, 10 million people, we must have a very sensitive mobile system for reporting.
Okay. Dr. Ashok Seth, the importance of nutrition, sir, in fighting COVID. What is the importance of nutrition in your opinion? And what is the role it plays in also keeping us safe?
You see, I think it's in every disease process. It's not just related to the virus itself, but we always believe, see, it's not as if you have to have specific, but you have to have a healthy living. And that's very clear. It's clearly been, it's contemplated and there is data for it that if you actually eat healthy, which means a lot of fruits and vegetables, that gives you good immunity.
Yeah.
If you exercise regularly, that gives you immunity. It protects you from infections. Yes, we've just talked about zinc and vitamin C as the other components, but what's also is that you have to get good mental well-being as well. You know, we disregard often yoga and other aspects of living. Again, those in a way do help. No specific data would tell you they help immunity, but certainly if you've got good physical and mental well-being, you're less prone to have infections. And I mean that even for spiritual well-being.
Yes.
Spirituality helps you.
Yeah.
So it's not as if you have to have a concoction of artificial things to say that I'm going to actually be healthy because I eat all this. Yes, as you know, our Ayush ministry has recommended certain aspects.
Yeah.
I think we should not disregard them because Ayurveda is a good science and it is a strong science of many years. So we should not disregard it, but we should not consider that as a portion that we eat, which will protect us. It adds on to everything that we do, including protecting ourselves in the manner that we've described with masks, good hygiene, distancing. And that is not just meant for your protection. That's one thing which protects others as well.
Yeah.
So I would actually say that, but I would also say less of alcohol, more of vegetables and nutritious products, good exercise, good mental well-being, remaining positive, are all ingredients to fight any disease process,
and
including COVID.
Dr. Mishra, you know, while speaking, of course, about immunity and nutrition, and apart from, of course, fruits and vegetables, magnesium, zinc, protein as well. You know, protein consumption can also help us stay very healthy. Dr. Mishra, do you agree?
Yes, I think I would agree with Dr. Ashok Seth that Ayush Ministry recommendation for kadhas is a wonderful concoction, which if you use, you are not harming yourself. It may benefit you in some way. Other things in our diet regularly we consume like lesson.
Yeah.
It has lot of good things in lesson. If you look at lycopene in tomato, for example, adrak. What are these things? Tulsi. What are these things? So now that is where we have a committee now. Dr. Sareen also is member of one of the committees constituted by Niti Aayog. And we are looking at integrative medicine or medicinal approach, joining allopathy and our Ayurvedic science together. I call it Ayurvedic science. We may not be like in UK. I read some Birmingham, they have developed a nasal spray for a barrier to the virus when it goes into your respiratory tract. Now, what is this Gayaka ghee?
Yeah.
When you lubricate your nostrils, it puts a barrier and it protects you from that virus entering the cells, entering the mucosa. That's how it is. So I think there is a lot of strength in Ayurvedic, particularly Ayurvedic system and Ayurvedic medicines, but it needs to be quantified, it needs to be verified, and that is what we are recommending, that we simultaneously join hands together to do some kind of a approach, protocolized based approach. That is what we are saying. I do almost 90-minute walk in the morning when I get up early morning, daily, on a daily basis. And then I consume some good amount of water before going for walk, after coming from walk, and then keep it simple. Keep the life very simple.
Yeah.
I think that is the message.
Okay. So I think Dr. Seth also wanted to comment on protein consumption, and can that also help build immunity? Dr. Seth?
All right. So okay, that was regarding the protein consumption. I wouldn't say specifically it's protein consumption. I think that protein is a very integral part of the diet. Yes, it actually it is needed, especially for increasing your how should we say, well-being. I would say that it's this mixture. I don't think it's one separate thing altogether. I mean, you've just heard the fact that it's a combination of things which increases your immunity. You can't be drinking heavily every night and say, I take kara in the morning, so my immunity is going to be good, but I don't mind that drinks every night. Or you just can't be not exercising and then say you're lying in bed and getting obese and say, my immunity is good because I have kara every morning. Yeah. So I think it's a combination of factors rather than dwelling on a single specific factor.
We've done a lot of problem busting of viewers. One last word to you, Dr. Tiku, before we wrap up. There's another, report that I was reading, and certain analysts, warn about poultry eating. That is harmful. Is that a misgiving? Can poultry eating also help build our strength and immunity? Is that another thing that you'd like to bust, Dr. Tiku?
Well, any kind of protein, whether it's lean protein, will help you to build your immunity. It has to be, as Dr. Seth said, it has to be a balanced diet. You can't be banking on one sort of diet which is protein-based or fat-based. And one advice I would like to give people is don't go for fad diets. Yeah. There's too much of fad diet thing going on, whether it's keto diet, whether it's paleo diet, just having fats, trying to burn your fats. But that leads to more complications. It's about immunity, is not just about the diet. It's a holistic thing. You have to work on your immunity through your diet, exercise, good sleep. I would say in these days, people don't actually get 8 to 9 hours of sleep, which hampers your immunity, and too much of alcohol. And what about smoking? Mm-hmm. Well, something very, very important. Smoking, you just have to give it up. There's so many patients who land in trouble, whether it's their lungs or whether it's their heart, because of smoking. And regular medical checks. Regular medical checks are very important. It doesn't happen in India. The concept is alien to Indians. But every 3 months, you should have one family physician with whom you exchange notes every 3 months, whether it's your family or your entire family household, and do regular medical checks. Majority of the population in India is vegetarian. You lack in vitamin B12 and vitamin D also. 80% of the population is deficient in vitamin D. So those vitamins are important. Apart from the fact that, see, I'm not somebody who has studied Ayurveda, but I'm a big fan of Ayurveda because I've seen through the experiences of my patients. And whether it's Chyawanprash or whether it's whatever, it does work. So it has to be holistically looked at. And it has to be a work-life balance. People are too stressed, too much stress, too much work, not giving importance to their family. I would
balance
say
lifestyle.
Yeah, work-life balance and give time to your family.
No alcohol, regular checkups, eat protein, eat fruits and vegetables, eat magnesium, zinc, have balanced vitamin B, good vitamin D as well. Add up on your vitamins if there's deficiency. But very important, as Dr. Serene said earlier, till we have the vaccine, and all of our panelists have weighed in on that, the mask is the vaccine. So use your mask effectively, maintain social distancing, and hopefully the vaccine will be out very shortly for all of us to take. Thank you so much, all of you, for joining us on this very special show as part of our Health Week coverage. Let's take a break. Much more on the other side.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.